Welcome back to my YouTube channel. I wanted to spend some time today talking to you about a unique innovation in neck lifting surgery. In particular, something that I do in my practice that is now picking up steam across the facelifting community. The technique I want to talk to you about today is Crevasse Technique. Crevasse Technique is a specialized approach to the lower face and neck, and it's something that I do in my practice that's unique and ultimately I think helps to provide better overall results in terms of the jawline and the transition between the jawline and the neck. Why is this important? Well, because so many times people ask me, what is it about your facelift or your neck lift that's different? Why do you have such good definition along the jawline? And how do you judge the quality of your results? And I would just tell you, I judge the quality of results of face and neck lift, not just mine, but everybody else's out there, based off of what happens in the neck. Because if you think about it, if you drop 15% here and 15% here with aging, that's like 30% down below. So if we adequately correct the issues in the face, the neck looks better. And the truth is that aging in the face is a matter of up and down. You know, gravity pulls the facial compartments of fat down over time. And when we lift the face, it's basically vertical, it's straight up. Whereas in the neck, aging occurs in the in and out trajectories. So aging in the neck basically goes out instead of just straight down. So we have to take the compartment of the deep neck and take those structures in the deep compartment, address them, lift them, and push them back in order to create the best contour. What is Crevasse Technique? You've seen me hashtag it, you've seen me mark it and talk about it in my videos. I'm going to go over that in great detail here today. This is going to be your deep dive in education. So, Crevasse Technique involves several things. A traditional neck lift involves an incision underneath the chin and in front of the earlobe or behind the ears. And through these different incisions, sometimes just an incision underneath the chin, people go into the neck and they tighten the muscle, the platysma, in order to give you better overall shape. The reality is we need to address the deeper structures. I'm a huge proponent of a deep neck lift. Why? Because if you think about it, what are the causes of neck aging over time? Why do we see heaviness in the neck in people's 50s, 60s, and later on in life? It's because the components, the compartments of the deep neck hang down over time. Those components include three key structures: the fat that's right beneath the chin, the anterior digastric muscle, and the gland, the submandibular gland. So I need to address each of these three structures, these three critical structures, in order to get rid of the underlying etiology, in order to get rid of the cause of the heaviness in the neck. Think about it. If we just tighten the muscle there that's deep, over time those structures will create additional pull, and it would be crazy to think that you wouldn't have the same results over time, as aging will naturally progress over time. But if I can treat the underlying cause, if I can get rid of the heaviness from the gland, from the muscle, and from the fat, over time they may not come back, or may come back much slower, given there's less heaviness, there's less actual of the causative agent of the etiology of the heaviness of the neck. I prefer a deep neck lift, and I think that most surgeons agree there's a lot of controversy. Most surgeons aren't going after the glands, aren't going after the muscle and the deep fat, and that's because many don't understand the anatomy in this area well enough to pursue a great result there. Many surgeons handpick or cherry pick patients that are going to have a great result that don't have a big gland, that don't have heaviness in the neck, and they put those results up and they look amazing, but those are patients that are very thin and don't have the underlying issues that many patients do present with. So I'm going to target all of these issues because my facelift is not a hammer and nail facelift. I target the very specific problems that each patient has, and that's how you get a great result. So in the deep neck, we go underneath the incision, underneath the chin, between the muscles, the platysma muscles, and into that deeper layer. We deal with the fat that's below the chin, right underneath the chin. We deal with the anterior digastric muscle, changing the trajectory of the muscle or thinning the muscle, and we deal with the gland here that's laterally. We deal with that submandibular gland laterally. We shave it down, we change its position, and we adjust its shape. And this is all critical because, again, we're dealing with those three deep structures. Once this is done, we take off a little bit of the platysma on either side. So platysma is naturally a sheet-like muscle that goes here on the neck. And we take off some of the redundant muscle and then bring the edges together. By bringing these edges of the muscle together, it creates a supportive network underneath the chin, like a trampoline that basically supports all the structures of the lower face and neck. And many surgeons do a deep neck lift and stop there. And I think that's reasonable in many cases because you're providing the tension from the muscle above. Now, where the Crevasse Technique goes further, okay, so this is an additional improvement on deep neck lifting, which you've seen from many surgeons out there across the world. This is a further adjustment, a further deepening of that overall jawline. Where it goes further is back here. We make an incision underneath the ear. If it's a deep plane face and neck lift, we've got an incision to access mid-face. If it's a weekend lift, it's just an incision in front of the earlobe, up the back, and to the hairline. But from here laterally, we dissect underneath the skin. We find that same muscle. Again, it's shaped like a sheet. So we take the edge of it here. We dissect underneath so that it's completely free. And then we pull that muscle up underneath the bone, underneath the jawbone here. This is called the gonial angle, in order to deepen the tension that's here. We make an incision over the mastoid, which is the bone just behind your ear. And from that incision, we basically create a T-like shape incision so that the front part of it can go down and the back part of it goes up. We'll show you that in the figure here. And then we attach that muscle to the bone. So we're moving the muscle from here to here and attaching it to the bone. That's creating a new tension underneath the jawline. It creates kind of a cantilever effect that pulls everything up in line with the angle of the anterior digastric muscle, which is shaped in a similar fashion. This allows me to create that depth underneath the jawline. This gives us the most sculpted jawlines possible. On the table, after doing this, so before and after doing this, we can actually measure the depth underneath the bone. And in the study, the article that I released recently, we actually looked at 200 or so cases of this. It was actually 150 total measurements. But in these measurements, we measured the depth between the bone and what's deeper, and then after the application of a traditional approach where people pull the muscle up and just attach to fascia, and after the Crevasse technique, which is what I'm telling you is a better version of this, and we found that when we went from just a standard measurement, it was 7 millimeters. When we do the Crevasse technique, it's 22. So we can deepen this jawline by almost 2 centimeters in many cases. That is a huge difference. I mean, that is a big change in patients. Having a much more sculpted jawline is what everyone wants. Nowadays, I think that the most sought after thing in facial rejuvenation surgery is improving the jawline and improving that transition. And I would just point out that this Crevasse technique is probably the best way to address what's going on in the neck and to give you the best possible transition along that jawline. So in the article that I wrote with Dr. Talley, we looked at all these patients, we looked at the results, and we show people how to do the procedure. We're going to show you a few of the key figures now, but a reminder, we're going below the chin, below the jawline, dealing with a standard deep neck lift, handling the gland, the muscle, and the fat, then reattaching the muscles in the midline, and then recreating the tension along the jawline to attach things to the bone here below. And again, this is a new technique. We just published the article on this quite recently, but I would just say that in the future we're going to be doing much more research, teaching this more often. This is something we give lectures around the country on. We wrote a textbook article on it as well, textbook chapter, and published all these other studies to improve the quality of care of patients around the world. But it is a new technique. It does provide the best result. Now, as a side note, I think that it's important to understand when you're seeking a great rejuvenation procedure, many patients are saying, I really want to look younger. And I think we can all agree that facial rejuvenation is about making somebody look younger. But there's also a concept of beautification, making them look more beautiful. And certainly, Crevasse technique takes it a bit further. Because if we were to just put your face back where it was, that wouldn't necessarily deal with the heaviness in the jawline. Many of these patients have a better looking neck than they ever had in their lives. They never had that relationship because of the anatomy and what's deeper. And we're changing the deep anatomy to give them a better looking jawline. So this does go beyond, a step beyond anti-aging, and really does go into this concept of beautification, making patients look more beautiful. And I don't think that that should be done in every case and in every aspect of facial surgery. I certainly think there are limits, but with regards to the lower face and neck and the jawline in particular, I think that's a safe space to really go after the best possible and most crisp jawline. These are the concepts behind the Crevasse technique. I've shown you a video now with a lot of deeper understanding of the concept. We've interspersed some of the photos throughout. There's a link to the article that you'll be able to find in my bio or in this video. And that can give you a little bit more information on what I do and how it's different. But these are important concepts, and you really want to go to a surgeon who can understand what's going on in this region if they're going to be doing a lower face and neck lift, but can also explain to you how what they're doing is different, if it is different, or how what they're going to do is going to improve that transition between the jawline and the neck. And I think that if you have the issues that need to be corrected, if you have big glands, big muscles, big fat, you need to go to somebody who can handle those issues and is the right surgeon, right match for you. So hope this has been educational. I know that it's a lot of different techniques that are out there, and it's very confusing to understand who the right surgeon might be for you and what anatomic approaches you need. But I'm a big proponent of the Crevasse technique, and I'm happy to continue to educate people on this. And I'm looking forward to treating more patients and showing you more of these excellent results in the future.